Okay, let's start with our very first talk of the day from Dr. Lloyd Tran. Let me introduce Dr. Lloyd Tran. He is chairman and CEO of Biomed Industries from USA. The title of his talk will be Neurogenesis, Hypothesis, and Clinical Trials of NA831 for the treatment of Alzheimer's disease and major depressive disorders. We welcome Dr. Tran.
Good evening, good afternoon, and good morning. My name is Lloyd Tran. I'm with Biomed Industries. We are located in San Jose, California. I thank you, organizer, and give me opportunity to give you a talk on the big topics in Alzheimer's disease. The title of my talk is Neurogenesis Hypothesis and the clinical data of the new drug NA831 for the treatment of Alzheimer's disease and also for major depressive disorder. As you know, Alzheimer's disease is a progressive disease of the brain that is characterized by impairment of memory and eventually by disturbances of reasoning, planning, language, and perception. There are more than 6.2 million people in the US and about 75 million people worldwide have this dreadful disease. I've been working this disease for the last 20 years because my family have experienced the sad experience of my dad went through the period of dementia and Alzheimer's disease. So a number of years ago, I decided to focus my research in this field. And I find that this field is very challenging. And there are a lot of drugs. Let me see, we're moving. A lot of drugs over the past 30 years failed. And basically, many of you are not familiar with the field, so I give you a big picture, right? And I hope many students, many young researchers, and many senior researchers take a look at this field, because this is very interesting to know that over the past 30 years, even more than that, the entire field of Alzheimer's disease was guided by essentially a hypothesis known as the amyloid hypothesis, which was postulated by Professor Hardy and Professor Kicking back in 1992, so almost like 30 plus 40 years ago. And they thought that the cause of Alzheimer's disease is by the deposit of amyloid beta peptides. So this idea was very simple and very elegant. And I think most of us in the field or people, common people on, other industry thought that the disease is caused by a buildup of a plaque, amyloid plaque, right? So, and this really controlled the entire thinking of scientists, researchers over the past years. And one thing I just want to tell you that, to my opinion, this hypothesis has not proven productive or any kind of benefit. And people will let believe very blindly, almost like it is a dogma where everybody will let to believe. And because the top scientists, the top professor of well-known universities say that, doesn't mean the truth, right? And I want to share you many young scientists that you should have the right to challenge any kind of ideas, including my ideas, anybody's ideas. Because if we do not challenge, we not, see the real result, it's still hypothesis. It's not the factual yet. It's not a theory that we have to accept it yet. Right? So let me see. Now, this is the list of a sample of about dozen drugs failed over the past 14 years. These drugs developed by major pharmaceutical companies in the world, such as Eli Lilly, uh, Semaglutide, Apiluzumab, Johnson Johnson, Varucestat by Merck, and I can list over. And many of these companies genuinely put effort, money, resources, cost them many $100 million, even $1 billion or more, to develop the drug from the idea in the lab to the clinical trials. Unfortunately, you can see almost all of them, or all of them, failed in phase 2, phase 3. And why is it? And this is something it intrigued my interest, and some of my colleagues at our company spent to study about that. And we find that the amyloid hypothesis is the beginning for the quest to understand what's going on in the human brain related to dementia. But the problem of this hypothesis is that it says that the Alzheimer's disease is defined by the presence of the amyloid plaques. So it is nonsensical to state that the disease is caused by amyloid plaque, because you define it, you already put your mind in one area and you define itself that the disease is caused by the amyloid, right? So within that definition, you already trap yourself in so-called circular definition. And this is very dangerous for researcher, because your mind already set something that is made not true, right? And let me go over the idea for you. The idea of the amyloid hypothesis, saying that the amyloid beta peptide is responsible for these diseases, partially true, but it's not true, because the amyloid beta have tremendous beneficial roles in human physiology. For example, it have antimicrobial activity. It can suppress tumor, and essentially it is a sealer to a leakage in the blood-brain barrier. It is very important. I go back to this feature. What it means that the amyloid beta binds the blood-borne, and it will protect the blood-brain barrier from external results. And it seals any kind of leakage. So by administer any drug that take away the amyloid beta peptides, you run the risk of open the leakage of the blood-brain barrier. And this is exactly what happened to many drugs that try to remove the amyloid beta. I'm here not to protect, not to defend amyloid, right? But I see that it's just a humor, such a strange for people to remove something that are really beneficial to human physiology. And also, it promotes recovery of the brain injury. For example, we thought that the amyloid beta is bad, right? And when you get old, you build up the amyloid and become Alzheimer's disease. In fact, it's not true. For example, a number of years ago, there was a young boy got hit by the ball in the sport game. 10 years old boy, and he died after a few days. So people did the biopsy of the brain. They realized that in this young brain, only 10 years old, human brain have so much amyloid beta. Why is it?
So
It turned out that the amyloid beta is the defense system for the brain. When the brain is suffering from a major injury, the human body makes amyloid to protect, to try to resolve and try to overcome the injury in the brain until too much and the brain collapses and the patient dies. So the amyloid beta is the defense system. It promotes the recovery of the human brain. So when you take away that human recovery Mother Nature gave us, you subject yourself to tremendous adverse effect. And lastly, amyloid beta regulate the synaptic functions. These are some typical characteristics I just highlight for you. And so let's look at a case study. Okay, this is the drug that I want you to take a look. in July 6, 2023, like 3 months ago, the US FDA approved lecanemab based on the controversial data that lecanemab claimed to produce cognitive decline. Okay. And if you look at the data closely, it is actually a wrong calculation, an embarrassing wrong calculation. After 18 months of treatment, lecanemab reduced cognitive decline by a measure of the CDR-SB, an absolute difference only 0.45 points, change from the baseline 1.21 for the drug versus 1.66 with placebo. And this is about 0.45 points. On the scale of 18 points, you look at that, you have the unit scale of 1 to 18. And this drug gave you only 0.45 points difference after what? After 18 months of treatment. So it is a very minor, it's very small. And by the way, I have no significant clinical benefits. In fact, a clinical study suggests that the minimal clinically important difference for the clinical dementia rating sum of box CDR-SB was 0.98 for people with mild cognitive impairment and at least 1.63 for those with mild Alzheimer's disease. So you have at least a 1 unit difference to mean something. And this drug, after 18 months treatment, gave you only 0.45, which is half of what a minimum standard. Now, if you look at the difference, 0.45, okay, which is a subtraction of 4.41 minus 4.86, give you minus 0.48. And this one is often presented by the company Eisai, Biogen, and all the media in the US say that it is equivalent to 27% less decline. But in fact, this calculation is wrong. It's misleading. It should be 9.3%. I don't want to spend so much time, but if you spend time, look at it. It is a simple arithmetic. Any first-year college student can make a simple calculation. You different 0.45 divided by 4.86. You should give them 9.3%, which is less, with a third of what the media, the company would let them believe. So in other words, this is what I understand today in the US, right? The FDA approved the drug lecanemab by Eisai and Biogen based on a very faulty data of 9% less decline compared with placebo. It's not 27%, right? And that's one problem. So the efficacy was very marginal. I don't think it is meaningful, but let it be so, okay? On top of that, this drug caused a lot of adverse effects, so-called amyloid-related imaging abnormality. This is a big word, but what it means is that it caused brain swelling. It caused microhemorrhage, okay? Occur in about 21%, almost 1/5 of the participants of the clinical trials suffering from brain damaging, brain swelling, right, and microhemorrhage. And at least 7 people dying during the clinical study. Anyway, that's the best of the best that amyloid hypothesis can give you, okay? So this is the problem. The problem is that the amyloid hypothesis is so flawed. After 30 years, it has not given us any kind of drug, any drug that benefit for the patients. Okay, the FDA approved lecanemab by Biogen in June 2021 and lecanemab by Eisai on July 2023 based on what we call surrogate endpoint biomarker. Biomarker endpoint surrogate means that you pick something and you call it a biomarker, but that surrogate biomarker may not directly correlate to the real disease changing. Okay. So, by the way, the entire industry was led to believe that the amyloid is the surrogate biomarker. So if you can change the change of amyloid, you can point to the FDA and say, hey, I make the drug that changed the amyloid in the brain, therefore approve my drug, even though that had little to do with clinical benefits. And worse like that, it got tremendous toxicity based on the reason I explained to you earlier, because the amyloid beta by mother nature is a intrinsic defense system of our brain. When you take away that, you subject the brain to a lot of serious problem, brain swelling, right? Leakage of the blood-brain barrier and so on. But anyway, the FDA conclude that reduction amyloid plaque in the brain is reasonably likely to result in clinical benefits, even though there are little significant improvement. I say that not because I'm critical, but I think on the behalf of the patient. I'm a scientist by training. I'm actually also suffering from the pain of my dad died of Alzheimer's disease, right? I see many patients in the community suffering from these diseases with little hope, right? I understand that it is a big news for us to see the FDA approve the drug, but unfortunately, the drug is not a real hope, right? If you take the drug, you get worse than you were without taking the drug, okay? Now, because of that, in the US, the Centers for Medicare and Medicaid Services, because CMS are known as the Medicare. Medicare is the agency in America, in the US, that's responsible for review the drug for reimbursement. Many people at the older age, at retired 65 years or older, they're entitled for Medicare, support of your, treatment. When you go to a doctor, when you get medicine, Medicare pay 80% of your cost of medicine for the cost of treatment in the US in the general terms. And Medicare ruled on April 7, the year 2022, that to date, no trial of an anti-amyloid monoclonal antibodies has confidently demonstrated a clinically meaningful improvement in health outcomes, meaning cognition and function for Alzheimer's disease patients. First, there is insufficient evidence to conclude that the use of monoclonal antibodies directed against amyloid is reasonable and necessary for the treatment of Alzheimer's disease. So this is not the FDA, it is a Medicare, which is responsible for $100 billion reimbursement in the US. For any drug to get reimbursed, you have to show efficacy and safety. And Medicare ruled that none of those apply for the drug lecanemab or aducanumab, right? However, under the pressure of nonprofit associations, including the Alzheimer Association and the lobbyists for Biogen, ASI, Eli Lilly, and others, in July 2023, Medicare agreed to reimburse FDA-approved drug with the condition that the treatment is monitored under the federal registry system, which is equivalent to collecting real clinical data in a large population. What it means that Medicare, under the pressure of the lobbyists for the company, and they yield because many people outcry giving the drug, right? So Medicare said that, how about this? We reimburse the drug with one condition, that the drug be monitored, almost like the drug is subject to another phase 3 clinical trials. And if it didn't work out, too bad, we won't reimburse you. And that's exactly what Medicare is saying, okay? I say that to give you that, the journey to develop the drug follow this hypothesis doesn't make any fruitful result, right? The best of the drug lecanemab and aducanumab over the past couple of years, which is a remarkable accomplishment for Biogen ASI, which I wholeheartedly congratulate them for that. But what you got is not very much. What you got, the drug that is extremely toxic and have little benefit to patients. Okay, so a couple of years ago, actually, the journal, the 2018, there's a journalist saying that what if our current hypothesis for the cause of Alzheimer's is all wrong? It's not me to ask this, but there's a small and increasing number of scientists in the industry begin to question. Come on, you spend so much time, give you all the time the world, all the money you need after 30 years, after about 20 drugs company failed for 33, and what you got is not much. So what's going on with the hypothesis? Shall we continue to do the same thing over and over again? Exactly what Albert Einstein say. The definition of insanity is do something over again and expect something different is all, right? So that's Einstein saying. Okay, so because of that, my company, over the past years, we looking for elsewhere. We think that it's no use to follow, the big leader, and they give us nowhere. So we decided to look into another approach, and we found that the hippocampal neurogenesis is something very interesting. Let me explain to you. One of the unexplained observations of Alzheimer's disease is that neurodegeneration takes place in lateral entorhinal cortex before all the brain areas. This brain area does not have elevated level of amyloid peptides in comparison with undamaged regions. So what is the cause of the vulnerability of the entorhinal cortex? What is the problem? One unique feature of the lateral entorhinal cortex is that it has newborn neurons that have undergone adult neurogenesis in the dentate gyrus of the hippocampus. Let me explain a little bit more. It is a very meaningful but very complex understanding. One is saying that over the past century until recently, people were led to believe that we are born with a fixed number of neurons. Right? Mother Nature said, well, you're born with, let's say, $9 billion neuron. And when you get old, your neurons getting tired, sick, and that's why you no longer think clear, and you become absent-minded, and you old, and you die as an old age, forgetful person. Right? That people common as. So they say that people born with a fixed number of neurons, and that once again that hypothesis been around for more than 100 years. Until about 20 plus years ago, people challenged us and no, the neurons continue to make the brain continue to make neurons. Even though you are older, you are middle age, or you a little bit more older age, even before you die, the neurons continue make new neurons. Okay, and this is very important because in the hippocampus, which is the center of learning and memory, there's a phenomenon known that the adult neurogenesis, means that even though you're adult, you're making new neurons. We thought that only the newborn baby make neurons. It's not true. We continue to make neurons until you die. And the number of neurons and the degree of making neurons determine how strong your brain is. If your brain making less neuron, it's too bad. You begin to lose your memory, cognitive, and you no longer have a sound memory when you were young. And that is the foundation of our hypothesis. Okay, let me explain a little bit further. Okay, this is the essential of the new hypothesis we are introducing in the community. Some scientists talk about that, but they have not come to the inflection point where we have a data to prove that the neurogenesis hypothesis works. Okay, now let me highlight a few things for you to appreciate what it means. The hippocampal neurogenesis is persistent throughout up to 100 years of age. That's where we can have a data, and it's detectable in the brain. In the brain, even in subject of 90 years of age, according to Professor Moreno, Jimenez, and Professor Thoma publication the last few years, they're able to measure and they can observe nestin, SOX2, and neuroprogenitor cells, DCX, neuroblast, and immature cell continue present and making new neurons to the subject at 90 years of age. However, they also observe that for those individuals that have dementia and Alzheimer's disease, there is a marked decline of the number of new neurons, okay? And the impairment of the hippocampus is the beginning of neurodegenerative diseases, in the beginning of dementia. In other words, the difference between the patient with AD, Alzheimer's disease, and the healthy mild person is that the patient with AD have less and less and a serious decline of making new neurons. So when you're not able to have ability to make new neurons in your hippocampus, the mind no longer be function with sound mind before, okay? And this is very important to observe that unlike the amyloid hypothesis, before you can measure any change of the amyloid in the brain, the hippocampal neurogenesis impairment takes place in that area. In other words, before you can measure the amyloid, which is too late, right? The brain already winding down, already degenerated, winding down. And so what it means is that to treat the Alzheimer's disease, we not treat the surface of amyloid. We got to go deeply to the root of it, look at the hippocampus, how we can make new neurons to compensate for the loss of the neurons, okay? So that's a common sense. And based on that hypothesis, we have discovered and developed the drug over the past many years. This drug, we call it NA831. This drug actually catalyzes the neurogenesis to improve the cognitive functions and serve as a catalyst to restore the neurogenesis, but also to restore the memory. And this drug is a small molecule drug. It easily crosses the blood-brain barrier. It's oral formulation, which is very important to have an oral formulation. And it we done the phase 1 study, so the drug is safe. It have a predictable pharmacokinetics. And based on that, we're able to did the phase 2 clinical trials of the drug for MCI, mild cognitive impairment, and for people with mild and moderate Alzheimer's disease. So we did the study here based on the FDA guideline, and there's about 118 patients. About 64 have the MCI, and 48 have early onset of Alzheimer's disease. The sex between the 53% male and 47% female, and the race is the majority is Caucasian, but only 60% Caucasian, 29% Asian, and about 10% Black and other people from different community. So this is the data. I summarize it a little bit more complex. Let me go over step by step with you. If you look at the right-hand side, it is a ADAS-Cog, which is the Alzheimer's disease assessment scale, 13 elements, right? On the top here is a ADAS-Cog. ADAS-Cog is a benchmark experiment for any drug to submit to FDA to show if the drug have any meaningful. And in this particular, the top graph, this is for MCI. The line on the top, the blue line here for drug treatment. And for the red line below is the placebo. So for the number of people take the placebo, they continue to decline over 24 weeks. And people take the drug, cohort of the people who got drug, they pretty much stabilize. I cannot say they improve because that's a little bit too early to say, but the result with the experiment data show that the patient took the drug stabilize over, they stable over about 6 months, whereas people took the placebo decline as usual. And this is the cohort of the people take the drug and the placebo, okay, over 6 months. The difference between the drug treatment and the placebo line is about 3.4, which is significant. However, if you look at the people who take the drug and they have Alzheimer's disease, the AD patient take the drug are actually pretty stable over 6 months, whereas the cohort of people take the placebo, they decline a little bit more profound than the other one because they are people who have serious case of Alzheimer's disease. The difference is more profound, about 4.1 changes different as compared with 3.4. The FDA guideline that anything more than 2.5 different is meaningful. And we got 3.4 for treatment of MCI myocardial impairment patient and 4.1 for patient with mild to moderate Alzheimer's disease. So overall, the result looks very promising. Relatively small number of patients, total about 118 people, but it is significant to demonstrate a promising to continue to do the phase 3. And adverse effect, the 4 patients have a minor adverse effect like some diarrhea and headaches, but there are no serious adverse effect. Only 4 people among 118 people did the clinical trial. So we continue here. And by the way, to compare the drug NA31 with lecanemab, this is the result of lecanemab on the right-hand side of the screen. The ADAS score comparison with the ADAS score of NA31, you see that the drug is pretty much stable over a period of time, whereas lecanemab, it declined. It declined in the same kind of pattern as a placebo. So the longer they take, the more decline. It means that is exactly what you see after 18 months. Lecanemab show very relatively small, even insignificant improvement, right? Okay, let me make a note that the lecanemab is not something you can afford easily. It costs a lot of money. In the US, this drug costs $26,000 per patient per year, plus about $61,000 you have to pay for the patient take the PET scan, MRI, and lumbar puncture, because the fundamental basis of lecanemab is amyloid. So to show the amyloid, and amyloid is very hard to measure, you have to subject the patient to MRI, PET scan every month, and the patient have to go through the lumbar puncture. Many of you are doctor, nurses, you know, this is really a painful procedure. Many old people, unfortunately, they are not well, versed in their thinking, and they cannot say no. Their children take them to the hospital. Many old people, they don't know what's going on. The young people, the children take them to the clinics, and they put either local or general anesthesia to the brain, let them sleep, and then take about 3 to 5 cc of this fluid from their spinal cord every month. To do what? To measure how much amyloid in your brain, which is, I tell you, not needed, painful, very expensive, and in the world, I think that totally, useless. Okay, and by the way, the drug lecanemab had to be administered intravenously every 2 weeks. The patient go to the hospital, stay there for 2-3 days. They get their brain scan. They take lumbar puncture, be there 2-3 days, and take the intravenous. And someone had to drive them to the hospital every 2 weeks. And by the way, it's not a typical small hospital. It had to be a major medical center who have PET scan, who have MRI. And it costs, that's why it costs $61,000 in US dollars. A total cost about $87,000 per patient per year. If the Medicare reimburses, they agree 80%, the patient still liable for almost $1,000 a month. And not many people in the US, I tell you, particularly older people who have fixed income, they may not be afford to pay their own pocket at least $1,000 a month for the rest of their life, whereas Medicare pick up the tab of $60,000 per patient. That's why Medicare and US are not willing to reimburse this drug, okay? And whereas our proposal is that our drug is not intravenous, it is a oral formulation, easily take the capsule, and much cheaper. We don't know how much it costs, too early to say, but well below what the price. I cannot say the price is not true because we don't know how much we will sell it when we got the FDA approved yet. But our drug does not require PET scan, don't require MRI, no brain scan, and no lumbar puncture, because we do not believe that amyloid is the way you should be based on. Okay, so another thing is during our many years research on Alzheimer's disease, we also discovered that the drug also have a potential application for major depressive disorder, which is interesting. In the US and around the world, there are about 21 million people in the US adults experience one or more major depressive episode, clinical depression, and about 350 million people worldwide have MDD per year. And this is not a simple depression. It is a called major depressive disorder. It is a clinical disorder, not because the patient suffering from unhappy experience. You lose your friends or boyfriend, girlfriend, you feel depressed. No, it is a serious clinical mood depression that require a lot of treatment. The patient is very hard to get themselves out from this serious clinical depression, right? And today there are a number of drugs in the market, but most of them have serious adverse effects. Some drugs even cause suicidal, for many people, and they develop some resistance as well. So we think that our drug could be a viable candidate. And luckily, the neurogenesis hypothesis I explained to you earlier also work for MDD, because we find that reduced hippocampal volume is associated with depression. And it is explained by the neurogenesis hypothesis as well. And according to Professor Hansen, that neurogenesis in the adult dentate gyrus can be regulated by stress and by antidepressant under certain defined conditions. And the adult hippocampal neurogenesis is crucial for manifestation of new memories and cognitive function, as well as regulation of mood. And so it have a remarkable related to MDD. So the neurogenesis hypothesis I have explained to you earlier have two roles. One is for dementia, people who lose ability to remember and to think clear. Also, they have ability to help young people to overcome the depression. So we did a small study. It is only the phase 1B study, and it showed a significant improvement over 6 weeks treatment on 32 patients with MDD. And we use the drug venlafaxine as a control system. And the drug showed significant improvement, and particularly NA81 have virtually no adverse effect for young people at all. So we think this is a viable drug to move forward, and we plan to do a phase 3 trial of the drug for the treatment of major depressive disorder in about 460 patients over 12 weeks. I'd be happy to tell you more. So in the conclusion, this is analysis of the drug here. In conclusion, we have introduced a neurogenesis hypothesis as a viable potential replacement for the amyloid cascade hypothesis. And the drug NA31 has demonstrated a proof of safety and efficacy as a potential drug treatment for MCI, mild cognitive impairment, and patients with mild and moderate Alzheimer's disease. We also found that the drug is a viable treatment for people who have major depressive disorder over 6 weeks treatment. So we are currently planning to do a phase 3 clinical trial for the drug for Alzheimer's disease, also with the patient with MDD. And we have to say that the neurogenesis hypothesis has served very well. It guided our research. It explained how the drug works and encouraged all the scientists, researchers, take a look, and we hope to form any kind of collaboration with you if you're interested in this field. With that, thank you very much for your attention, and you can contact me. This is my email address. I'm with Biomed Industries, and you can visit our website and contact me if you have any interest or question. Once again, thank you.
Thank you so much to Dr. Tran for explaining so much that I couldn't even prepare a list of. It includes so much that employed hypothesis, amyloid hypothesis, challenges of amyloid hypothesis, and the future estimated. Plus, there was mention of lecanemab also, and how costly the treatments can be. That was really impressive. Thank you so much for the insightful presentation. Let me ask if any of our attendees have any question to be asked. Also to the LinkedIn Live attendees, please ask your questions. You can ask your questions now. Yeah, there is a question from Anuj. Should I read out the question for you?
Yes, please read the questions.
All right, Dr. Tran. It's
know
from
where
Anuj.
Yeah. Okay, is it a question or is it on the chat?
It is in the chat box.
A
Yeah.
chat box. Okay, chat box.
Yeah.
Okay, I don't see. Can you please read the question to me?
Yeah, sure. It is, can this concerned drug can be used in Parkinson's considering its neurogenesis property?
A very good question. It's possible, but we don't have time or resource to look into it. Right? We know that it have a viable application. The mechanism action of the drug for Alzheimer's disease is slightly different from Parkinson's disease, but there might be a potential benefit. Particularly right now, we are collaborate with all the companies. In other words, we study the combination of our drug with all the drug in the market. Suppose there's certain drug treatment of Parkinson's disease, or even some drug on ALS, and we collaborate with all the companies that study the potential combination of our drug and them. So I don't have clinical data to tell you, but thank you for your interest, and we are working on that field.
That's great. Thank you for the question, Anuj, and thank you for taking the question. Okay, there is another question. It's from Anuj again. Is Biomed planning to go in that direction with a modified derivative of this drug in future? Yeah, Anuj, you can ask the question by unmuting yourself. Come up on your screen and ask it.
Yes. Yes, we certainly expand our research. What I show you is one of our first flagship drug. We have several drugs in the clinical development, and we work on different analogs, different derivatives, and we expand. We found out the neurogenesis is a very big field, and we just understand very little about it. And there are a lot of room for us to expand, a lot of room for collaboration with all the companies and all the universities to expand. But correct, it is a big field. You know, when we prove that the neurogenesis make a lot of sense, then the amyloid, I think it opened the entire horizon opportunity for us and for many companies to do that. And the more we work on it, the more we feel that we're more confident, because we were able to fix the problem at the deep root of the disease, not just a superficial amyloid, which is, we believe the amyloid beta is a part of the big system, but not the cause of the disease. And unfortunately, the industry spends so much time and money for something it's not fruitful. So now we have to start actually reverse the beginning to do it. This is something we feel excited about that. Thank you.
Thank you very much, sir, for the response.
All right. Thank you for the question, Anuj, and thank you for taking the questions, Dr. Tran. So let me ask if anybody else is having any questions from Dr. Tran. Yeah, you can unmute yourself or come up on your screen and ask the question. This way, it will be easy interaction. Yeah. Especially to the students who are here today.
Sir, I would like to make another query. It's Anuj again. Sorry to interrupt.
Sure.
Yeah, I was just curious, like how safe are these drugs? Like, are there any result posted anywhere for the clinical safety of these drugs, the upcoming drugs of your company that we can access? Is it accessible to the public right now? We would like to, know more about it.
Yeah, we've been published at a number of medical journal and at the international conferences. Not this conference, but we invite to give a talk, and our data have been published in abstract journals. For example, we present our data at the Alzheimer International Conference, in the big conference with about 4,000 or 5,000 scientists. It's a peer review, and you can look at our profile. We show the efficacy and the safety of the drugs. So you're welcome. Since we keep the things in a very quiet, we have not promote the drug in a big scale because we face with a lot of competition. The entire industry go marching in one direction, we go different direction. So most of the opinion leaders still believe that the idea was correct, but we among the very few people saying it's not good to follow that. So we among one of the minority to resist against the hypothesis, and so we don't have a lot of big support, but luckily we have a number of small group of scientists. The idea of the amyloid been around for many years, and over the past number of years, there are many people challenge the hypothesis, and I'm one of them. You can look at the story of Professor Mark Smith. Mark Smith, he's a relatively young professor. He was murdered in 2010, about a number of years ago. He was one of my mentor. We actually discussed with him, and he the leader of the group to challenge the hypothesis. Unfortunately, he was killed, but I don't know why people. So actually, a lot of resistance against that. You deal with the pharmaceutical industry, with the big industry, and the small company like us challenge the hypothesis. We take a lot of resolve to do so. So the way we do it, we just try to present our data at international conference. For example, we have 4 papers to present at the clinical trial Alzheimer's disease CTAD conference, which was a big international conference, about a couple thousand people around the world come. And they were held on October 24th to 27th in Boston. And we invited to give 4 papers. By the way, this is one of the 4 papers we present. So actually, we tell you the data before we give the big conference. So we like to share with you. So get a grassroots movement. Many of you are researcher, young researcher, students. I hope you inspire and questions the current hypothesis. The advancement of science, particularly advancement of medical, only become fruitful when young generation rise up and ask questions and challenge. And that, unlike if you look at the electronics industry, anything that won't work won't last more than 3 years. You know, suppose you make a something like, you remember, almost like pager, right? Maybe you're too young, pager. Many years ago, everybody had pager, and it lasts for about several years, and then it will obsolete it. Right? People use a cell phone, right? Cell phone. So in many industries, like electronics, particularly, anything that's not good won't last long. It's totally, obsolete, right? In the medical field, different. Many of you, all of us, in medical field, right? In the medical, it's different because you spend years to learn it, right? People almost, share with you, and you have to remember. You sit the test, and you get the degree. So you went so much time to learn, and you, including me, we all respect the medical authority, right? Because they, before us, of course, we show respect to our teacher, professors, so on, so on. That's a part of our learning. But at the time come when you see the results are not good, right? For example, Professor Mark Smith in the 2010, he, my mentor, he raised the questions, and everybody attacking him. He lost his grant, he lost his position because of, hey, you crazy. Everybody do this, and you're the only one go opposite. So he lose a lot of, but anyway, up to the point he saw every paper he present, they reject him. Nobody published paper. Guess what? He's so upset that he decided to open his own paper, the Alzheimer journal, Alzheimer disease. You check it out. A journal AD, one of the most respectable Alzheimer disease. Before, when he raised the question, all journal, Lancet, all kind of New England Journal of Medicine, they all reject and say, we don't believe you have anything. Right? And he published, he actually made his own journal. And this journal, he founded that back in early 25-6, become a remarkable accomplishment. And now it open-minded so that everybody can present the idea, right? And one reason I like to share with you, because I think, this is something that people who are not in the establishment can take it easy. People in the establishment, they don't like it. They don't want a change. They don't want people who challenge them. And but anyway, we have gained tremendous attraction. We move on to do phase 3 clinical trials, and we engage to all the collaboration with companies, and we feel that we get there sooner or later. It's just a matter of time. So thank you for the question. I don't want to take a lot of your time. I know you have all the speakers. Let me rest to really enjoy talking to you.
Thank you so much. Yeah, we hope your product will be revolutionary in this field. All the best.
Thank you. Thank you very much. Yeah.
Yes, indeed, Anuj. And we are very sorry to hear about your professor, Mr. Mark. Yeah. So that was a really great discussion. I thoroughly enjoyed it. Even I was just a listener here. So that is how we do a particular discussion, everyone. If you are having any question, any doubts, you can just come up on your screen and ask the questions. Feel free to do that. Yeah, this is a open platform for all. Any more questions? Any more queries for Dr. Tran? Please come up and ask your questions. Okay, there is one that Dr. Tran, you mentioned about major depressive disorders, right? So, yeah, what could be the reasons of that?
Very good question.
Yeah.
I think you need to get back to my slide. Okay, so
Yeah.
share the slide. Okay. Let me see, where is this? Okay. Okay, one of the idea, I not say that the only idea, is that one of the cause of major depressive disorders is the temporary disorder of the neurogenesis. The neurogenesis actually is a dynamic system. It not be there and it stop. It is ongoing all the time, right? Sometimes happen to your brain that phenomena somehow temporarily disrupted. Okay. And you and I know that our human brain was sort of marvelous organ. It produces many million neurons, new neuron every day, because every day the neurons get old, some of them die, right? And new neuron continue generated. That's why the reason you and I have a stable thinking, clear mind, we did not know that our brain continue make fresh neurons, and the new neurons receive the synaptic signal from the previous neuron to process. That's why we have maintained the memory continue. However, some people, they lose that memory capacity. Sometimes I know people who suddenly they no longer remember things in the past, or some people lose the memory recently happened, right? And it's temporary. The fact that you have absent-minded, or the reason you forgetful once in a while, it's not unusual, it's not abnormal. It is a normal part of your brain until the time comes you continually decline up to the point the patient no longer remember everything, or no longer recognize your loved one, right? Or you no longer remember where you are, and you couldn't manage your life. That is a serious part of the clinical diseases that need to be taken care. Now, the MDD is similar. Many young people, they not make up like, the people who've been living for many years. They're suffering some, temporary setback in their brain. Suddenly, because of some phenomena, make them feel depression. The depression could be environmental, could be relationship with their loved one, could be something that trigger depression. But now, most people, they feel sad for a week or two and then they get back again. But unfortunately, some people, when they sunk into depression, it becomes neurodegenerative problem. It deteriorated, okay? And the body could not make enough neurons to overcome the dysfunctional signal in your brain. And that's why you deep dive, go all the way down. Many people, they feel sorry for themselves. They want to commit, suicide. This is a phenomenon of depression. They overthinking. They have a bad mood. They feel hopelessness and worthlessness. They feel very insecure and guilt and all kind of phenomena, and they suffering a temporary setback. I think depression is not a long-term chronic disease. It is a temporary setback. Okay, and with that case, you need to be boost up. The same thing, our brain is not too far from, in fact, the computer imitate our brain, right? Sometimes this is how good you have a computer. I have a very nice and modern MacBook. I love it. It's really beautiful machine and work for me very well. But sometimes I need to turn off. I need to reboot the system. It doesn't matter how good you are. Our brain the same. Our brain, every day you process a lot of signal, million signal. Your neuron work day and night, even when you sleep, the neuron begin to rearrange it. The line computer got defragmented, right? Remember in computer, sometimes you need to defragment it. Your computer, you get a good memory. Your brain work not far from that, even much heavy, high level on that. So as a result, the human brain need to be rebooted, need to be refreshed, need to be regenerated, need to be refreshed, right? So the function of neurogenesis, okay, in a general term, is the ability for the brain to refresh itself with the new neurons, to reconnect the synaptic system, to overcome a lot of dysfunctional of small neuron, cause you feel deeply unhappy with your life, and these can be overcome. So many people have depression. They decided to go vacation, right? You go camping, you decide to climb your Mount Everest for the sake of it, and then you said I need to forget about my feeling of my failed relationship, my failing of my job or my company. I need to go for a break. And these people, by exercise, by get out from their normal living, somehow they feel better. They feel boost up. It is true. At the same time, your brain feel refreshed. You got a new idea and you lift yourself up. Unfortunately, some people, they couldn't do that themselves, right? That's why they need the external medical intervention come in and boost them up. And that's why the drug like ours, all the drugs could be a treatment by regenerate, by boost up your brain thanks to the neurogenesis. Okay, so that's what the best I can tell you. I don't know the whole cause of depression. There will be, I'm not expert in neuropsychiatry, but I'm sure many professor in this field can explain you. But one thing I know, neurogenesis can play a very important part to help our memory, our cognitive function, but also our mood and our, psychological mental health. I hope it makes sense to you.
You said, Dr. Tran, that you are not an expert, but let me tell you that I just really love the details you provided and the examples you provided to make it clear to me. I mean, yeah, I just got it.
You got it. All right,
Thank you
right. So
so much. Yeah, I just
I hope
got
in the
it.
future, some of us, include myself, we feel depressed. We say, well, relationship didn't work out, this, that, and I feel disappointed. I sit in the room, close the door, and you feel sorry yourself. Right? No reason to do that, And you always think like that. Your mind is a marvelous, right? Mother Nature gave you a wonderful mind. Okay, the same thing you say that you have super million times more than your computer, and that computer, it functions very smoothly, right?
Yeah.
You don't recognize your brain works so hard. Remember, in your brain, you have more than 9 billion neurons continue work for you, and you don't recognize it. From time to time, it runs into some issues, right? Setback, it's not a big deal. Let me tell you, one word advice. Suppose you run into some problem, you should tell you, first of all, it's not a big deal, come on. I have ability to rejuvenate myself. I got happy, I smiling, I go for a walk, I go camping, I smiling, shake hand with my loved one, I kiss them, I hug them, and I spend time with my friends, and I forget about myself. You know what? During that time, your body can regenerate. It uplift itself and look up. And I hope you don't need my drug, but if you need it, I can give you some drugs and take you to 2 weeks, few weeks, and you get better again. I'm not here to say anything, but I believe in Mother Nature, in the human ability to regenerate itself. And if you do it well, perfect. You have a happy life. Okay,
Definitely.
I think it's enough. Okay, I need to rest and let everybody have a chance to speak. Okay, thank you.
That was great. That was a really great saying. And what do you know, Dr. Tan, what I do? I have a like trick that whenever I'm in a depressive problem, then I will give the problem only 7 days, a single week to the problem. And if I can solve out the problem in 1 week, then okay. In case I can't, then I will leave it to let it be, move
Let it
forward.
be. Yeah.
Yeah.
Sing the song, let it be, right? Not a big deal. Your mind always had remember, your mind is a wonderful things Mother Nature gave you. It have an internal resistance. It have an internal build up. It's very safe. It's really good. Yeah, but you have to believe in your mind, your ability first, right? And then the scientific people like me, we just learn what the brain work. But the more we learn, the more we find it's wonderful. I cannot tell you how beautiful I can see it. It has so many things that I couldn't express. I appreciation for Mother Nature, give us that kind of wonderful thinking, right? And with that thinking, you can overcome a lot of things because inside you have the ability to defend itself. Okay.
Yeah. Yeah.
Oh.
And I just got a question, and I'll just quickly ask the question and quickly collect the answers, and then we will move to our next speaker. Okay, Dr. Chan, with your permission, shall we do that?
Another question? Okay.
Okay.
What question?
I'm just asking everyone in the meeting room, in the live stream. Everyone, what do you do to feel better? If you are in depressive state, what do you do? All of you, please share. We can get some new ideas, you see. And I would request all of you to come up on your screen if possible. Come up. Oh, come on. I feel like I'm talking to a screen. Thank you, Dr. Tran, for the prompt action. All right, everyone. I'm asking to everyone, the students present here also, and the live stream also. Let me know what you all do. If you are in a depressive state, what you do to feel better? What make you feel better? And do we have Dr. Sampurnam here? Okay, it's the answer from the live stream. It's Anamanya, and she said that I go out, mix up with friends, and I feel better. That's great. Listen to some music.
Yep, that's right.
Yeah, music is the healing. Okay, yeah, speak up. Sleep. Okay, Anuj. Yeah, so many people around me do that too. That's a great idea. Okay, what about others? Come on, come on. We just have 1 minute, and then we will move to our next speaker. Okay, Dr. Sharat said he work out at gym. That is great too.
Your son.
Work out again. Go outside. All right. I'll have some food. Okay, great. Have some sweets if you are feeling depressing. It helps. All right. The 1 minute's up. Let's move to our next speaker. Yeah. Everyone, our next speaker is one of the students from Dr. Sampurnam's college, and her name is Miss Sana CT, and the college name is Bhavani College of Nursing, Erode, India. Title of her talk is Limbic System and its Scientific Importance. Yeah. Sana.
Hello, ma'am.
Hello.
Hello, ma'am. Can you hear me?
Yes, definitely, Sana. Can you come up on the screen, Sana?
Ma'am, here is not electricity.
Oh, that's fine. Okay, Sana, do we need to play the slides for you then?
Yeah, ma'am. Sure.
Okay. Okay, Sana, your voice is having some echo sound. Are you in some empty place?
Yes, ma'am.
Okay, okay. Can you speak up something again? Let me help you.
Yeah. Okay, ma'am. Can
Okay,
I speak?
okay,
Is it my
Sana.
voice is audible?
Yeah, your voice is audible, Sana, and it's better now. And please don't worry, be comfortable. I'm here to help you in case of any need. Fine?
Okay, ma'am.
Yeah, our team member will play the slides in a while.
Okay.
Okay. Okay. Can you see the slides, Sana?
Yes, ma'am. I can see.
Okay. Yeah. All the best,
Good evening.
Sana.
Thank you, ma'am. Good evening to one and all. Myself, Sana CT, BSc Nursing first year student of Bhavani Nursing College, Erode, India. My topic is limbic system and its scientific importance. Ma'am, next slide.
Okay, Sana, you just have to say next and we will play the next slide.
Okay, ma'am.
Yeah.
Okay.
Perfect.
Abstract. The limbic system is a, ma'am, 1 minute.
Sure, Sana, take your time.
Hello.
Yeah,
Can you hear me?
yeah, perfectly.
Okay, ma'am. The
Okay.
limbic system is a complex network of brain structures involving in the various emotional and motivational process. In brain, there is a special structure called limbic system which controls our emotions. It plays a crucial role in the regulating many aspects of our behavior and physiology. The, the scientific importance of the limbic system lies in its contribution to understanding emotions, memories, motivation, and several neurological and psychiatric disorders. Next. This is the picture of limbic system, which consists of thalamus, hypothalamus, amygdala, and hippocampus. Next. Emotion regulation. The limbic system is closely associated with the processing and regulations of emotions. Structures like amygdala are particularly important in detecting and responding to emotionally significant stimuli. Studying the limbic system helps researchers and understand how emotions are generated, experienced, and controlled in the brain. Ma'am, next. Memory formation. The limbic system, particularly the hippocampus, is essential for the formation and consolidation of long-term memories. Research on this aspect has been crucial in advancing our understanding of memory and its disorders such as amnesia, memory problem, stress and anxiety. The limbic system is involved in the body's stress response and the regulation of anxiety. Ma'am, next. Psychiatric disorders. Abnormality in the limbic system have been linked to various psychiatric disorders, including depression, anxiety disorders, post-traumatic stress disorder, and bipolar disorders. Neurological disorders. Damage or dysfunction in the limbic system can lead to range to neurological disorders. Next. Brain mapping. Advances in neuromapping technique have allowed scientists to map the activity of the limbic system in real time, aiding in diagnosis and treatment of neurological and psychiatric disorders. Evolutionary perspectives. The study of the limbic system provides insight into the evolution of emotion and behaviors in humans and other animals, shedding light on the adaptive function of these neural processes. Next. Conclusion. It is essential responsible for shifting through an organizing lower order processing and declining sensory information to other brain area for higher order emotion processing. This is my topic, and it's over. I think you all enjoy my presentation, and now I thank the organizing committee members of this conference. In special way, I thank Gessel for the constant and timely help. Thank you.
Thank you, Sana, for being here and presenting the talk. And being the very first time, it was good.
Okay, ma'am.
Yeah. And let me tell you, you are having one of the best mentors, Dr. Sampurnam, present there, and she will teach you pretty well. She herself is a great speaker, I tell you. So be confident and follow her, everyone.
Yeah, ma'am.
Yeah. So, dear attendees, do we have anything we want to discuss? Anything you would like to ask us or from any of our speaker, or you would like to discuss something? Please come up and ask your questions or write down your questions in the chat box or in the comment section for the LinkedIn live streams. Yeah. Be confident. And yes, we will keep having such interactions in future as well, because we are having a series of events lined up for every year. We are still having so many events left for this year, for this particular year, for the left out months we are having for this year. Yeah. So let me announce our next event. It is about brain stimulation, the International Live Conference on Brain Stimulation, and the event will be on 21st of October. And here I have provided the direct link for the event in the chat box. All right. And please stay connected. I will ask for the details, which will be helpful for the certificates preparations. Okay. In case you want to give a presentation or provide a talk, please share your abstracts with us, your research abstracts. The links are provided everywhere in the event pages, on the website, on the posts. And in case you want that again, I will share it. Ask me and I'll do it. Yeah. Any questions to anyone? All right, till then, let me request to all of the attendees in the meeting room, please share your full name along with your title, as it is Mr., Miss, Doctor, Professor. Okay. Share your full name plus your email address and your country name. Please share the details in the meeting chat room. The following information will be used to prepare the certificates. Okay, I guess we already find our active participant of the day. And Mr. Anuj again proved it. Thank you, Dr. Sampurnam, for leading your students to our meeting room today, and your kind visit as well. Did I forgot to ask for the email address also, dear Anuj, and the Vivo user? Okay, Miss Preeta, please share your email address also. I'm sorry if I forgot to ask the same. Please share your full name with your title, your email address, and your country name. Everyone. Till then, if you are having any questions, you can ask the questions. Being the question from Dr. Tran, from Sana, from Dr. Sampurnam, from me, and from any of the team from All Shares, please go ahead with your questions. I would like to repeat again that Our next event will be on brain stimulation, and it will be on 21st October. If you are interested to provide the talk, please share your research abstract with us.